So, when you were first diagnosed with type 1 diabetes, did you or your family have any idea about what caused it?
No, so my family had no idea what caused it, and it happened during COVID, when COVID had just happened.
Hmm.
It happened in 2020 December,
Hmm. So,
and we had asked the doctors what might have caused it. They
hmm.
said that they had seen a rise in type 1 diabetes after COVID started. So
Oh.
we believe that it happened because I had been COVID positive
Hmm.
a few months prior.
So, how did it feel to get this clarity about something that wasn't in your control?
Honestly, I had no idea what was going on. I was completely clueless.
Mm-hmm. Because there's nothing you could do, right?
Yeah, that too.
Hmm. And then, have you ever encountered any myths or stigmas about diabetes? Like, people think it's caused by eating too much sugar and stuff. So, how do you respond to those kinds of comments?
See, so there are two types of diabetes, type 1 and type 2.
Mm-hmm.
Type 2 happens because of your lifestyle. That is true if you have a lot of sugar, if you eat a lot of unhealthy food, that could cause diabetes type 2. But type 1 is an autoimmune disease, which basically means that your own immune system attacks your body.
Mm-hmm.
So that's not in your control at all.
So, what's one thing about managing diabetes that you wish people understood better?
Exercising, definitely exercising.
Hmm.
So exercising is extremely important because it helps you control your sugar levels and it's also overall good for your body.
Yeah. And have you ever felt judged or misunderstood because of your diagnosis?
No, definitely not. People understand that it's a condition and they don't judge. It's the
Um,
same thing as someone having cancer. It's almost an incurable disease and you just have to live with it. So people don't judge.
so, do you think living with diabetes has changed how you see yourself or the world around you? And are there any lessons you've learned because of it?
See, it has not changed how I see the world or myself, but
Mhm.
the most important lesson I've learned is how to take care of yourself.
Mm.
And once again, how important exercise is.
Yeah.
Because before I was diagnosed, I did not take exercising very seriously, and I would only go play football a few times in a week, or and barely for an hour or two in a day. But
Mm.
now I'm going every day for 3, 4 hours, and I also do cycling after dinner.
Mm. If someone is struggling with their diagnosis or feeling ashamed because of the stigma, what would you want to tell them?
Same thing I said before, there's nothing to feel ashamed of. It's just natural and it can happen to anyone.
Mm.
And there's nothing weird about it.
Some people think all types of diabetes are the same, so how do you explain the difference, especially with your own experience of type 1?
Okay, so type 1 diabetes is an autoimmune disease, which basically
Mhm.
means that your own immune system attacks your body, in this case, the pancreas, and
Mm.
that's what causes type 1. It's you can't control it and it's not based on your lifestyle. Whereas type 2 diabetes is based on a lifestyle. For example, if you eat a lot of sweet food or a lot of unhealthy food, or you don't exercise enough, that could cause type 2.
Also, how do devices help with this for type 1? What exactly do
Hmm.
you do to increase or decrease your glucose levels?
Okay, to monitor my glucose levels, I use this thing called sensor. It's basically it attaches to your skin through a needle, and there's this device, a reader. You can use that to check your sugar level any time of the day,
Mm-hmm.
and you don't have to, for example, prick your fingers and test your blood,
So do you do this
which many people do opt for.
so do you do this after every meal or only 1 to 2 times a day?
Not it's more often every meal, every hour or so,
Okay, okay.
because the range that your sugar should be in is about 90 to 150, and you should
Mm.
not let it go below or above that range because it could be dangerous.
Hmm. Because it's so frequent, like every hour of the day. Is it something you've
Mhm.
gotten used to? Does it still affect you a lot?
I've gotten used to it, and it's not that big of a deal
Hmm.
because it takes less than 5 seconds to check your sugar because of this. And modern technology has definitely helped a lot.
Okay, great. Thank you.
You're welcome.